Today we have a very special guest, Mr. Victor Raju, a practicing clinical nurse who specializes in psychiatry. And he will talk to us today about the nursing profession and his current focus. Mr. Victor has done his bachelor's degree in nursing and has practiced in a clinical environment for many years before he pursued a specialization as a mental health nurse. So, welcome to Marga, Mr. Victor.
Thank you. Thank you very much. Thanks for the invitation.
So let's get started. Mr. Victor, your profile is very interesting. Can you please explain what led you to make all of your professional decisions and how you navigated your career?
Yeah, it's very interesting question. Some personalities or some persons are very interested in helping others and serving others and giving them comfort when they are in the need. So I was very interested in helping others and into service system. So that's what led me to take my professional decision and take nursing as my career. And when it comes to the how I navigated my career, when I started my career, I started in the year of 2013. I worked as medical surgical nurse. I was there in the surgery department. I was preparing the patients for the OT and post-operative patients I used to care, which is very helpful for me, which I learned all the skills. And that was the first step which helped me to grow in my career. Then I was interested in psychiatry because when I was in BSc, I was very much interested into the psychiatric subject. So that's when I went to the psychiatric hospital. I've been working at psychiatric hospital for almost 7 to 8 years now. Now I'm working as a nursing superintendent. I lead all the major uh, IP things like that might be retrieving a patient or ECT or any other mental health related documents. I manage all that and I work as a nursing supervisor as well. That is how my career developed. It is because the interest I had in the psychiatry and the nursing.
So, what inspired you to initially come into the profession?
It's more than inspiration. Like I said, I was interested in helping people. And one more thing that caused me to choose nursing, it is because I was very much interested into healthcare sectors, and I was very much interested into science. I was very much interested in the human anatomies. I was very much interested into this kind of things. That led me to get into the nursing field. Sorry, which me to get into the nursing field, and whatever I felt that I should be, that was fulfilled here. It is because I was inspired by it.
That's great. What personality traits do you think generally fit to be in this field? Because it's very demanding, and like, what keeps healthcare professionals motivated?
It's very simple. The personality trait, more than personality trait, you should have a quality of compassion. You should have empathy. You should you should be thinking like they are your family members in simple words, in a simple knowledge. If we have that kind of personality trait, if we feel that what they feel, then definitely that is the personality which fits into nursing. If you are unable to uh, have a compassion with the neighborhood or anyone next to you, you won't be able to care them. When there is a compassion, that is when you will to care them. So this is the first personality trait everyone must have. And next, it should be like you should be advocacy to the patient. You should be like advocate to the patient. You should be representing his needs, what he wants. You have to represent it. That is one more thing. And one more personality trait, you should be a good organizer, and you should have the good leadership skills as well, so that you can lead the entire ward or and the patient needs, their demands. So I think the first thing, the first quality is to have the compassion. That is how the nursing field evolved. Like when you talk about Nightingale, so she's the one who brought the nursing into limelight. So the first quality, first personality trait she had is compassion. So I believe that compassion is more important. That is the first personality trait.
Okay, and what minimum education qualifications is needed to be in this career?
The minimum education qualification should be a diploma in nursing. It's a 3 years course where they will go through all the fundamentals of nursing, human anatomy, and all other related things to the nursing. So they are eligible for gaining a nursing license once they get the registered nurse label. So then they'll be ready to work in the hospital. I think that is the basic thing. If someone wants to build their career, someone will go for the BSc, which is a bachelor degree of nursing for 4 years. Someone who's interested into the teaching side, they'll go to the MScs. So they'll have specialization. We might talk in the next question, I guess.
Yes. So, what specializations are available for aspirants who want to grow in the nursing field?
There are many specializations currently, um, medical surgical specializations. We have like someone is interested into OT, operational theater, someone into ICU nurses, someone into mental health, some are interested in industrial nursing side, some are into occupational health nurses, same industrial and occupational health nurses. So we have many specializations. If they want to choose a specialization, they must be that must only happen after completing the BSc nursing. Then only they can go for MSc nursing, which they can choose the specialization. And some are, when it comes to the hospital, when they complete their course, when they get the registered nurse, some are interested into OT, they'll go to the OT. Some are interested into ICU, they'll go to the ICU. So it all depends on their own interest, and we have many specializations like that. And it is very booming industry when it comes to the industrial nurse, occupational health nurse. Most of the peoples are not aware of it, but it's one of the booming industry currently now.
Okay. So, could you please tell us more about your current focus in the mental health area?
In mental health area currently, if we want to focus, or even anyone want to focus, is on rights of the patients. I think we majorly focus on the rights of the patients, and we give all the what are the individuals who have the rights in the society will have the equal rights to the patients, like rights to access their medical charts, and they have all the rights to choose the treatment. They have all the rights to know their diagnosis. They have rights to know what treatment is going on. They have the rights to know what medication is used on them, what side effects might cause on them, and they have rights for their clothings, and rights to access to the contacts. They have all the rights. That is there in from the beginning, but now it has become mandatory because we have a new act called as Mental Health Care Act 2017. See, it is from 2017 it is there, but it is came into functioning from 2018. From there, they prioritize on patients' rights. So we have a new review board also. So mental health review board. So to watch the hospitals, how they're functioning, how they're keeping the rights of the patient as per the law. So I think majorly focusing on rights of the patient.
Okay. So, last question. If any of my fellow high school students are watching this, what would you say to them to motivate them to come into this field?
Definitely, I'll definitely motivate them because uh, it's not only a good option for a person who is interested in healthcare sector who comes. One more very important thing is it's very demanding. Every hospital, every clinic will have vacancies. Someone who did nursing will not be empty at home. Everywhere go, you'll have a job. Everywhere, every hospital, every clinic will have a nurse. So nursing currently, as per NABH, 1:6, the general wards, and 1:1 in the ICUs. Actually, when it comparing to the ratio, the demand for the nurses is more because Indian population is more, and our nurses are less. So it's very highly demanding, and you can grow in this career if you put your efforts in it. Definitely, you'll grow, and it's very demanding, and you'll not be jobless, and your career will also grow.
Okay, great. That's all I had for today. Thank you, Mr. Victor, for your very valuable time in supporting this initiative.